I'm with the Minister for Health and Social Care. We're doing questions and answers. We didn't get Monday yesterday because, you're busy, obviously. Today being Tuesday, recording this, and you've got a press conference tonight. We've dealt with that in part one, but stay tuned because, things can change. So we're recording this at 1 o'clock. No one knows. We had 4 more today, didn't we, announced?
Yeah, again, high-risk contacts already in isolation, so nothing of concern.
This is a question. A serious misunderstanding of what steam packet staff should be doing. It's been on the boat during the border restrictions. This person did 2 return trips. I explicitly asked a member of the passenger-facing staff what he did when back on the island. He said he didn't have to isolate at all as long as he didn't get off the boat in Heysham. This seems like a bit of a colossal. Miscommunication between the COMIN, DHSC and steam packets. A miracle that an outbreak has not happened. Now, again, this goes back to
the first thing I've got to say is there's no miscommunication in government. Right. Council of Ministers or DHSC. DHSC, by the way, just for the record, isn't actually involved in the direction notices. That's all done in a separate area of government. But in relation to this, the direction notice is very, very clear. I think you said you've seen a copy of the direction notice. You said in part 1 of our interview. It is absolutely clear what should be following.
You are on the right.
Somewhere there is a breakdown in communication between the steam packet who've had the direction notice given to them, and I know that Public Health has sat down and had previous meetings with them, and that's why we need to have an investigation of what went wrong. But from my point of view, that's fine having an investigation in what's gone wrong in the past. I'm keen for us to move forward and find a situation that actually allows the steam packet crew to continue to live some semblance of life, and at the same time allows us to protect the island. That for me is the crucial point. We can spend our entire time arguing over what's gone wrong in the past, and there will need to be an investigation into that. But for me, the crucial time, crucial thing is ensuring that.
I've got a question. A question to me. And why have I been served a D notice? I haven't been served a D. Do you know? I had to look it up. D notice in the UK is when the government can stop a broadcaster from asking a question of national security. I know. Right. So there's a whole theme that I've been zipped. I just want you to actually.
I don't think anyone could ever accuse you of being zipped, Paul.
Because I was quiet on Friday's press conference, apparently. But
included by time on the council, I think you've been interviewing me for the best part of a decade now, if not longer. Yeah. And I can guarantee, as someone who you interview, I can't recall you ever being zipped on any topic.
That's fantastic, because you're hearing it from
I'm glad you clarified what a D-notice is, though, because I would have had to look it up myself.
I'd look it up. That's unusual to catch you on those things. You know everything. Okay, this person's been on their first COVID-19 vaccination, and there are a couple of concerns. I came away from the hub at Bronsway. I must say it's set up well. The staff are cheerful and pleasant. But one, although there were social distancing markings on the floor, the seated waiting area where all the chairs are was shoulder to shoulder. And given the current situation with the recent positive cases up and the location concerned, I found it quite disturbing that one member of staff came across wasn't wearing a mask, even the face mask for the staff. I would have thought in the current circumstances the wearing of masks would now be the norm. Now I understand where I sit, but somebody else could sit next to me.
Currently there's no social distancing requirements, and there's only the normal PPE requirements in healthcare in place. The clinical view is that is still appropriate at this time. As I've said, I know people are concerned out there, but at the moment there is no view that we need to change any of that. The wonderful thing about the Ronalds Way hub and also the Chester Street hub is that if we need to switch back to social distancing and it's felt clinically appropriate to do so, we can do so with the waiting areas. But at the moment there is no restrictions on Ireland, and that includes in relation to health services as well.
The next question possibly makes up 99% of the mailbag this week, and that, I'm going to go on this, is about the spacing between the 2 vaccines again. I thought you were going to make the big change today.
I will be making an announcement at 4 o'clock today.
Oh, you
I'm
will?
not going to say what the announcement is.
I can tell you're going to change it. You're going to change it.
So we will wait and see. The clinical advisory group originally was due to meet to discuss this 2 weeks ago. For various reasons, that meeting had to be cancelled due to the availability of members. They met again last Thursday. They've made a recommendation to myself as Minister, and I will be able to announce that recommendation.
You said there were no big announcements. That's a fairly chunky bit, because that changes a lot of things, doesn't it?
Well, it depends what the announcement is, Paul.
True. And going on, the other thing was you got so many vaccines sitting in storage, not get them out, use them. Very low the other day, 200, which then was revised to 400.
Yeah, well, we need to be very, very careful here, because we've got to remember that even if you delay the second dose, so I can actually give the figures right here, right now. You'll hear them. You'll hear them again 4 o'clock. So it might give you a chance to come from the question on them. But I'm
lost tonight. I've got to find a question.
But in relation to the second dose, even if we switch the second dose, it speeds the vaccine program up by 10 working days. So 2 weeks is what it actually speeds up by. It does not have a dramatic impact, because we still need to vaccinate people. All it does is it pushes that out. So what you will see, for instance, with the UK, where people are looking at the UK figures now and saying the UK is way ahead in first doses, what happens is everything starts to then slow down, because they're going to hit that point, even although it's dragged out further to 12 weeks now, they're coming up to that point where they will need to start delivering people the second dose.
Well, we could be in that situation if you say, well, I think you're going to say tonight.
But again, we need to be very careful around the science on this, but it will depend upon what my announcement is tonight.
Why so slow this last few days? I mean, there's 200, which got revised to 400 though. Is that a blip, or is that
No, because again, it's as we've explained throughout, the most efficient way to run the hubs is on high volumes. So we do days of high volume. Right. So rather than spreading the same amount of doses out over 7 days, we can do a large amount of doses over 3 days in a week. So it doesn't alter the amount of vaccine delivered, because we can still only vaccinate to the supply that we have.
But you've got quite a lot in the fridge, it says.
We can do 4 second doses reserved.
Right. Confused. If the initial case was confirmed this week, this is obviously one that's positive, that came from the cluster. Why is the Balcomine school bus from last Friday, the number 31, classed as low-risk location, the date of which precedes the initial case that the cluster came from?
Yeah, because it's been such a time period. So one of the things we look at from venues is not just the interaction, and I think Director of Public Health can probably explain this much better than me on Friday, but I'll give it a go anyway. It's to do with a mixture of things. So we don't just look at the risk posed by the environment, or the actions of the individual. We also look at the time period that has moved on since then. So for instance, a bus, if it was for instance a packed bus with lots of individuals crowded around that other individual, if that individual had been shedding virus at that point, you would expect that symptomatic cases would have been popping up from that environment. No such cases have been identified in that way, and that means that the venue is low risk because of the amount of time that has moved on. So you may remember again, I mean, I don't like calling it the 1886 cluster, but that particular cluster, people might remember if they go back and take a look, we had exactly the same thing, where there was cases where it had been up to 7, 8, 9, 10 days afterwards. So because of that venue then becomes low risk, because you would have already been seeing people presenting with the symptoms. Henrietta makes a much better explanation than I do, but hopefully that made sense.
Henrietta used the word super spreader the other day and almost fell off my seat, because remember when I said it, she did not take that very lightly. Anyway.
I wasn't at that briefing.
No. Can you ask about the breakdowns, people waiting for the COVID test? Do they count each test as a separate person? Is that a true figure of one person, or is 3 people? The key workers that come over on the ferry, the guy that brings the paper is counted, and maybe somebody else. Does that make sense?
So yeah, I think I know what the person's getting at. Sure. In terms of the testing, and I apologise if it's not what the person's getting at, but in terms of the testing figures are individual tests undertaken. So for instance, someone has a day 1, day 7, day 14. We report the actual number of tests undertaken, not the people.
So it could be the same person.
So the person will be reported in their day 1 testing figures, their day 7 testing figures, their day 13
So it's not individuals,
testing.
it's just the amount.
It's not individuals, it's actual tests undertaken. So and that way, if someone tests positive on a day, but the one clarification I should actually give to that is in terms of number of cases, if a person tests positive on their day 1 test, and they're then obviously put into isolation, but they then test positive again on their day 7 test, they're not counted as 2 cases.
No.
So their case number is still in terms of case, but in terms of the number of tests undertaken, the numbers go up.
This one's a text. It might be missing a word, but I'll read it exactly. So could you ask if, as a crew member, can my family come to my house to visit my wife and children, but not myself?
That would be very hard to do, I would say.
I'm not quite sure what they mean. Do you understand?
I think what they're trying to say is can the wife and family visitors round and guests round while
but
the
not
crew
meeting
members
that
there
person.
isolating in the home.
You're doing very badly.
The direction notice is to the person isolating at the address. I would personally say no, that wouldn't be allowed, because it would be someone entering that area that is subject to a direction notice.
This might have been done, this one, but I think...
Under the current circumstances, of course.
Right. I think when the government lists numbers of how many awaiting tests, are the numbers very clear? I think not. Yesterday there were 95 awaiting tests, small number awaiting results. Today 160 awaiting tests and none awaiting results, and one positive result. Does that mean that 160 are the ones from yesterday awaiting tests, including that they need to be more exact? No smoke and mirrors.
Right. It's not smoke and mirrors. People have got to think about the practicalities of this. When we put figures out, the testing process goes on throughout the day. So it doesn't just, it's not just an arbitrary point where it ends, because we have to take the testing samples, then they have to go through the lab, then they have to be processed, and people have to be notified of the results. So the figures I, for instance, give out at a briefing, or if there isn't a briefing you see published on the website, is a snapshot from the lab's figures at the point it's taken. So, for instance, I will normally take that snapshot about 2 in the afternoon when I'm doing a briefing, same as today. And those are the figures that will be read out.
So they're not conclusive, they're just the latest.
They're not real time, so they're, in that sense, you've always got to, at some point, because the process is consistently ongoing throughout the day, you've got to take a snapshot. So you will always have, in terms of people awaiting, different figures.
Is your dashboard, though, up to date? I mean, is that moving at all?
In which dashboard?
Well, in
particular
dashboard? I thought you had a dashboard that keeps everything moving along with figures.
So in terms
the day, was that not
the lab one does? The lab one itself
but that doesn't deal with that.
But we've got to actually at some point publish the figures in a day, and so that is a snapshot in time from that day.
Why did you hold them back the other day? You know, when you moved the briefing back to 6 or whatever, why not still put them out at 4? What was the issue that day?
We always try. To
Do you want the big announcement at 6?
No, we always try to coincide it with the briefing.
Oh, I see.
And we've had that rule since the start, that on days where there's briefings, the figures will be released. So, for instance, today I'm doing the briefing at 4 o'clock, so the figures will be released at 4. The reason is it allows that if there's any confusion, or you guys in the media want to ask a question about those figures, you can get the question out there and then, and there's no confusion out in the public. The questions can be asked straight away.
What if you'd ask the Minister if they would consider running a poll on the Isle of Man to the public, asking them what they think would be the best thing to do should any community cases arise, since we are the ones they are making the decisions over?
Yeah, I mean, we run on a representative democracy, so it is members of the House of Keys and ministers that ultimately make the decisions. I can assure you, certainly I can assure the public as a minister, the public isn't afraid of telling me what they actually think.
Is your mailbox worse than mine, isn't it?
I get a very wide variety of views.
Yeah.
I think actually a poll wouldn't help matters, because it's not an arbitrary choice of one or the other. I think what you'd end up with is probably with about 20 different views as what should happen, and all of them probably roughly around about the same percentage.
Okay, we're doing well. I know your lunch is waiting somewhere. 2 of the children that tested positive are from Ballacameen and St Thomas's Primary School. The government announced Ballacameen, but not St Thomas's Primary School. This is fact that they both have it, as I know the parents of both children. St Thomas's School also share the school with Ballagill Primary School, so that is 2 schools at risk. Do they mix they do mix in the playground and have lunch and assemblies together?
Right. My understanding, and I stand to be corrected on this if I'm wrong, but my understanding is with the St Thomas's one, there was no wider risk, because the child that's concerned, and I've got to be careful what I say because I can't do things identifying people, but in that particular instance, the person was already in self-isolation, and when it was worked back in terms of when the contraction point of that case would have occurred, it did not involve the school.
Right.
So with the Ballacameen one, as I think the Minister for Education explained on Friday, Friday. In relation to Ballacameen, the school did come into the potential for the point of infection, but I believe with St Thomas's it didn't.
Okay. Final question. That I was stopped for this one this morning, and it's the lady is she's blind, not 100%. She got the dog though, and she says she cannot get the exemption order. She can't wear the mask. She's got the underlying health issues, and she's tried her doctor. She's tried 111. She's been sort of turned away from certain shops because they have a policy of having the mask without some sort of ID, how does she get that information that she can put some around her neck or tell people that, look, I have an exemption?
Well, I would hope that most shops would treat people on face value. We don't do exemption cards.
Well,
as
that's
I've said before, we don't.
I know, but maybe
because we
should.
don't. It's very hard to do because how would you enforce it? You'd have to do a clinical assessment of the individual, which I think in many cases would be quite distressing.
Well,
to
she's
the
got a
individual
dog with her, so I think
themselves.
it's sort of.
And I was just coming to the point that I would hope that should we ever need to go back to masks, that most retailers would be sensible about it. And if someone is claiming they've got a medical condition, I would hope people wouldn't falsely try and claim that. And in some cases, it can be pretty obvious. I know certainly from speaking to retailers and seeing it in practice myself that most retailers did take a very common sense, responsible approach, and that if someone said, well, look, I'm not, they may be challenged, fair enough, but when they were challenged, they said to people, you know, I've got a medical condition, and the retailers accepted that. So, you know, I think trying to go down the route of having these exemption cards and everything else, which would need a clinical assessment to formally say, yes, you do need to be exempted, could actually be more hassle and trouble than it's worth, and take longer.
Thanks for joining us. As I said, this is recorded on Tuesday lunchtime. This gentleman, you taking the whole thing yourself?
It's me this afternoon, Paul,
yes.
as far as I'm aware.
Good. I'm right at the bottom, so I know
you're
find something to ask.
So you're stuck with me, and I'll see you virtually at 4 o'clock.
And obviously, clearly there's indications that it might be a change to the vaccine levels, and when the time
Well,
is.
I said there'd be an announcement, Paul. I didn't say there'd be a change.
I know. I'm just simply saying there might be. That's what I'm saying.
Wait and see.
As always, thank you seriously for your time. We'll be having another one next week, so if you've got more questions, news@manx.net. I'm looking at the Twitter as well, huge amounts, but maybe there's been a little bit of radio silence, though. I think that's came across that people are wanting more information. Have you taken that on board? That people love to hear from you and people.
I mean, it's as we've said in the past thing to actually put out there. I mean, I can quite happily, and people who know me know, I could quite happily stand at a podium and talk for Britain every single day of the week. But it's about having useful information to impart, because if you're only giving half stories or you don't have complete pictures, that can actually panic people more than anything else. So as I said, we needed to wait.
Damned you do, damned you don't.
Yeah, we need to wait till we have actual facts, and as we have always promised, as soon as we have those facts, we will go straight out to the public, and that is why we are holding a briefing today rather than waiting for Thursday.